This is JAPI, and welcome to JAPI Podcasts.
JAPI Podcasts, August 2025. I am Dr. Nihar Mehta. A warm welcome to JAPI Podcasts of August 2025, issue of JAPI, Volume 73, Issue 8. This issue of JAPI has some really interesting articles, including 9 original articles, 3 review articles, 1 update article, 1 point of view, 2 pictorial CMEs, and 3 letters of correspondence. Let's discuss these in detail. The first original article is on the use of ambulatory glucose profile in monitoring and improved control of gestational diabetes mellitus when compared to self-monitoring of blood glucose by Mohammad Sabah Siddiqui et al. Now, gestational diabetes mellitus is hyperglycemia diagnosed for the first time during the second or third trimester of pregnancy. It often leads to neonatal complications, and effective management of gestational diabetes is crucial to mitigate such risks. This study evaluates the effectiveness of ambulatory glucose profile versus the self-monitoring of glucose in managing this condition. It was an 18-month observational study including 65 pregnant women who were diagnosed with gestational diabetes. 32 patients wore the flash glucose monitoring system, and the 33 others performed self-monitored blood glucose monitoring. Now, blood glucose levels were monitored using the AGP group, that's the flash glucose monitoring system group, and the SMBG group, that's the self-monitored group. The data was collected fasting, postprandial, and hypoglycemic events were recorded till 15 days after enrollment. The AGP group showed significant reductions in blood glucose levels all across measured times. The mean glucose concentrations decreased significantly in both groups from enrollment till 15 days, with no significant intergroup differences. The AGP group had a higher mean time in range, that's 92% versus 90%, and lower time above the range, that is 4 versus 6%, compared to the SMBG group. Hypoglycemic events were also fewer in the AGP group. So the AGP group demonstrated superior effectiveness in managing gestational diabetes by providing continuous glucose monitoring, improving glycemic control, and reducing hypoglycemic events compared to the self-monitored blood glucose group. So, the AGP is recommended for better glucose management in gestational diabetes patients, an important takeaway from this study. Let's move forward to the next original article, which is titled Cardiovascular Metrics in Hospitalized Male Patients with Acute Coronary Syndrome by Meenakshi Sarda et al. In 2010, the American Heart Association introduced Life's Simple 7, LS7, to improve cardiovascular health by emphasizing disease prevention and lifestyle changes. This score was calculated by recording blood pressure, fasting glucose, total cholesterol, BMI, diet, physical activity, and smoking or tobacco use. 7 important parameters. Scores were categorized into 3 groups: 10 to 14 having ideal cardiovascular health, 5 to 9 intermediate, and 0 to 4 poor. This case control study aimed to find the prevalence and distribution of the LS7 metrics in hospitalized male patients with ACS compared to healthy individuals. It involved 50 males of ACS and 100 male controls in the age group between 21 and 50. In this study, the ACS cases had a mean LS7 score of 7.68 lower than the control group's score of 9.39, showing poor cardiovascular health. There were higher prevalence rates of hypertension, 28%, diabetes, 12%, and dyslipidemia, 4%, which were significant contributors to the acute coronary syndrome. Smoking was highly prevalent along the ACS cases in 96%, with an odds ratio of 12.77. An ideal BMI was present only in 48% of cases, with an odds ratio of 2.5. STEMI was prevalent among the ACS cases, with single disease, that is, single vessel disease, most common in angiographic findings. So, this study concludes that suboptimal cardiovascular health metrics are there in the ACS cases compared to the controls. And this highlights the critical role of healthy lifestyle choices and managing these modifiable risk factors in reducing the ACS incidence and improving the cardiovascular health outcomes in individuals. Quite a reinforcing study on the value of lifestyle measures. The next article is on the circadian blood pressure profile and associated cardiovascular risk factors in pre-hypertensive patients and its relationship with the urine albumin creat ratio by Jaldu Krishna Pavan et al. This cross-sectional study investigated the circadian blood pressure patterns and associated cardiovascular risk factors in pre-hypertensive individuals. Their relationship with the urine albumin creat ratio and high sensitivity CRP was studied. 101 adult participants, of which 57.4 were pre-hypertensive, ambulatory BP monitoring revealed 44.8% of the pre-hypertensives were non-dippers, showing less than 10% nocturnal BP reduction, a pattern linked to higher cardiovascular risk. Non-dippers had significantly higher nighttime systolic and diastolic BP, as well as elevated hsCRP levels, indicating increased systemic inflammation. UACR, that's urine albumin creat levels, were also higher in non-dippers, although not significant statistically. Compared to normotensive controls, pre-hypertensives showed a significant elevated 24-hour, daytime, and nighttime BP, along with higher hsCRP levels. So, this study underscores the value of ambulatory BP monitoring in identifying non-dipping patterns in pre-hypertensives, which are associated with not only inflammatory risks but also renal stress markers, which suggests an early intervention requirement in this high-risk group. The next original article is titled "The Influence of Problem-Based Learning Method on Learning Outcomes in Medical Curriculum" by Sara Banu et al. Traditional teaching program is usually in the form of didactic lectures and is very teacher-centric. A large number of topics can be covered without active student participation. Problem-based learning, on the other hand, is student-centered, in which the students learn through analysis and problem solving. So, in the problem-based learning, which promotes deep learning, students learn to justify their knowledge with the help of cognitive skills and complex thinking. This very unique retrospective study was done with data from 3 internal assessment exams written by 151 students pursuing the second MBBS training in the Department of Pharmacology. The examination papers from these students contained questions like short notes, ultra short notes, and problem-based learning questions. The results showed that there was an increase in the pass percentage, that's the number of students who scored 40 and above, in the internal assessment exam with problem-based learning when compared to those without problem-based learning. So, this very interesting audit shows that definite knowledge improvement by students using problem based learning as a tool is very important along with the traditional teaching program to enhance our learning capabilities. The fifth original article in this edition of JAPI is titled The Incidence and Pattern of Transfusion Reactions and its Association with Blood and its Components in a Tertiary Care Hospital. This study was done by Sonia Gupta et al. Blood transfusions are now safer. Still, the inherent risk of transfusion reactions continue with transfusions of blood and blood components. This retrospective study is a review of data which analyzes the incidence and the nature of these reactions in a blood center from January 2020 to December 2022. A total of 165,121 blood and blood components were issued, and the transfusion reactions reported were in 296, that is 0.18%. Febrile non-hemolytic transfusion reactions were 151, which is 51%, and they were the most common, followed by allergic transfusion reactions in 111, which was 37.5%. The estimated risk of transfusion reactions per 1,000 units was highest with whole blood, that's 3.84, followed by packed red blood cells, that's PRBCs, that's 2.85, which was statistically significant, and single donor platelets, that's 1.45. The most common symptoms observed were fever, followed by chills, followed by rashes. And the febrile non-hemolytic transfusion reactions, which was 17.8%, were reported amongst frequently from gastroenterology, allergic, 23.4% from emergency, and delayed hemolytic transfusion reactions from thalassemia daycare center. The incidence of actual transfusion reactions remains underestimated due to the lack of awareness regarding transfusion reactions among healthcare professionals. The next original article is titled Decoding Ghabrahat, a cross-sectional KAP study of healthcare professionals understanding and managing the complex South Asian medical term, by Rahul Garg et al. Ghabrahat is a term used by patients, especially in the South Asian population, to describe non-specific symptoms related to multiple organ systems which can hide serious underlying medical conditions. To non-specific discomfort, now this creates difficulty in interpretation and diagnosing and treating the patient accurately. Ghabrat used by many patients as a primary complaint on the first encounter with the healthcare system is a complex symptom which includes various organs and organ symptoms, which can include palpitations, anxiety, depression, panic attacks, chest tightness, breathing difficulty, giddiness, tachycardia, epigastric discomfort, nausea, restlessness, just irritability, and very often just a feeling of impending doom. You can understand how non-specific and ambiguous this symptoms is, and this is why it is a diagnostic challenge for healthcare professionals and can lead to over-investigations of minor ailments as well as, more importantly, underdiagnosis of serious medical conditions. Many studies were done to analyze the healthcare professional knowledge, attitude, and practice, KAP, knowledge, attitude, and practice, regarding Ghabrahat. The various studies revealed enormous exposure to Ghabrahat as a primary complaint. The majority of healthcare professionals associated Ghabrahat with multiple bodily organ dysfunctions, in which cardiovascular and psychological disorders were the most common differentials. Other organs included adverse drug reactions, endocrine disorders, gynecological issues, anemia, dehydration, and electrolyte abnormalities. It was also found to be associated with patients' underlying comorbid conditions. More than 50% of the patients complaining of ghabrahat attributed this to higher mortality, making it the tip of the iceberg of an underlying serious health condition. This finding contradicts the assumption that ghabrahat is a benign or non-specific complaint, and hence careful workup of such patients is definitely needed. So in toto, clinically ghabrahat is being treated as a complex symptom which needs further evaluation and should not be ignored, as it is a condition that requires a holistic approach to the diagnosis and treatment. The next article is on prevalence of hypertension in young adults in Punjab by Manpreet Singh Brar et al. The study was conducted to know the prevalence of hypertension in young adults in Punjab, and this observational study was conducted as a part of the global blood pressure screening program in adults of 18 to 80 years. A total of 24,685 participants completed the study, including 43.5 young adults. The prevalence of hypertension in young adults was 9.2 and in older adults was 18.8%. About 71.8 hypertensive young adults were overweight or obese. Males demonstrated 16.7% prevalence of hypertension as compared to 12.3% in females. Whereas in young adults, 28.4% females had hypertension as compared to 26.6% males. This study concludes the increase in the prevalence of hypertension among young adults and its association with overweight and obesity, necessitating the initiation of hypertension prevention and control strategies, especially focusing on young adults. The next original article is titled The Viva Voce Exam Using Unstructured Impromptu Questions and Structured Viva Voce Cards, a comparative study among final year MBBS students in the subject of internal medicine by Abraham M.I. et al. In the medical curriculum, the Viva Voce exam, that is by word of mouth, was the earliest form of formal assessment of medical and other apprentices dating back to pre-medieval times and is a crucial component of formative and summative assessment. The primary objective of this study is to ascertain whether there is a significant difference in the assessment between the Viva Voce conducted using extempo questions versus that conducted using structured cards. This observational study took place over 3 months. The exams were conducted by 4 examiners in internal medicine amongst the final year MBBS students of the 2020 batch. Initially in an unstructured manner, using extempo questions, and later using the structured questionnaire of increasing difficulty in the form of printed cards. A theory examination was conducted before the Viva Voce. In addition, a feedback survey was conducted among students and examiners to assess their perception. Students scored best in the unstructured Viva, followed by theory, followed by structured Viva. There was a moderately positive correlation between the unstructured and the structured Viva and theory scores. There was a poor correlation between the Viva and perception scores for both unstructured and structured Viva. The examiners had a slightly more positive perception towards the unstructured Viva method than the structured method. Unlike most studies in the preclinical and paraclinical subjects, this study is a contradiction, with students scoring better in unstructured method and faculty also showing a preference for the same. This invites further research on the effectiveness of both the unstructured and structured Viva in the clinical setting. The next interesting study is on the correlation of the glycemic status with angiographic severity of coronary artery disease in acute coronary syndrome by Varsha Rakshitha Prakash et al. Given the intricate relationship between diabetes and cardiovascular disease, assessing the influence of glycemic status on cardiovascular disease severity is essential. This study aims to evaluate the severity of coronary artery disease in diabetic, pre-diabetic, and non-diabetic patients presenting with acute coronary syndrome. Conducted as a cross-sectional study over 6 months in the hospital involving 150 patients across the acute coronary spectrum who underwent coronary angiography. Clinical parameters were monitored, including the history, comorbid conditions, biomarkers, HbA1c, ECG, echo, and angiographic findings. The severity of coronary artery disease was assessed using the Gensini score. The study analyzed 150 patients with acute coronary syndrome who underwent coronary angiography, comprising of 114 diabetics, 20 pre-diabetics, and 16 non-diabetic individuals. A male predominance was observed with 100 male participants. Diabetic patients exhibited the highest severity of coronary artery disease with a mean Gensini score of 49 plus minus 39, followed by a pre-diabetic patient with a mean score of 24 plus minus 41. This is absolutely expected, but the difference between this and the non-diabetic subpatients who had the least score with a mean score of 0.94 plus minus 2.5 just highlights how different a diabetic and a pre-diabetic patient behave compared to non-diabetic patients. Interestingly, triple vessel disease was more prevalent among diabetic individuals, and a significant positive correlation was observed between diabetes duration and the coronary artery disease severity. So this study confirms what we already suspect, that is, diabetes significantly exacerbates the severity of coronary artery disease, with diabetic patients exhibiting more severe disease than pre-diabetic, more than non-diabetic individuals. Additionally, the findings demonstrate a direct correlation between the duration of diabetes and the increasing severity of coronary artery disease. The results emphasize the heightened risk of triple vessel disease as well in diabetic populations. We will now come to the review articles, the first one being titled Newer Therapies in Osteoporosis, a Systemic Review by Parthajit Das et al. Therapies for osteoporosis include anabolic therapies like teriparatide, abaloparatide, and romosorzumab. Anti-resorptive agents include denosumab and bisphosphonates, calcitonin, and selective estrogen receptor modulators. These agents increase bone mineral density and reduce the fracture risk. However, there is a limited evidence examining the protracted efficacy and safety of the newer therapies for osteoporosis. Hence, the analysis was done by the authors. A total of 1,038 publications were scrutinized, 18 RCTs. In these, 22,668 women were postmenopausal osteoporosis, that's PMO, 473 men with low bone mineral density were included. Studies on the newer therapies for osteoporosis, that is, abaloparatide, romosozumab, and blosozumab, were discussed. In addition, the efficacy of sequential therapy or combined therapy with these newer agents with anti-resorptive therapies was also evaluated. The median duration of the intervention was 24 weeks, and the primary outcome was the LSBMD. The results showed that newer anabolic drugs, abaloparatide, the active trial showed superiority of this drug versus teriparatide. The ATOM study studied the efficacy and safety of this drug in men with osteoporosis, and the active extend study suggested that this drug, succeeded by alendronate, is an attractive strategy for sequential therapy. Romosozumab, several trials demonstrated the efficacy in increasing bone mineral density and reducing the fracture risk in postmenopausal osteoporosis and in men. It was more effective than alendronate or teriparatide and also showed efficacy in sequential therapy, with most effective sequential therapy being anabolics followed by anti-resorptive therapy. In the FREEM study, the ROM denosumab group demonstrated lesser fractures. The ARCH study reported less fractures in the ROM alendronate group in comparison to the alendronate group. And major cardiovascular events, hypocalcemia, osteonecrosis of the jaw, and atypical femoral fractures were higher in the ROM, in ARCH, and FRAME trials. In the anti-resorptive drugs, this predominantly included the biphosphonates and denosumab. Sequential therapy showed that the bone mineral density gains were larger with the anabolic therapy, that is the ROM or abaloparatide, followed by anti-resorptive drugs like denosumab or bisphosphonate, compared to the reverse sequence. Active and active extend analyzed that the favorable bone mineral density results were with the abaloparatide alendronate group. Victor study showed efficacy of the ROM followed by denosumab or ibandronate as a sequential therapeutic strategy, where denosumab was found to be more efficacious than ibandronate. Combined therapy, the data switch study reported that the largest bone mineral density gain with combined teriparatide and denosumab therapy for 2 years, followed by denosumab monotherapy for 2 years, compared to teriparatide for 2 years, followed by denosumab for 2 years, and denosumab for 2 years, followed by teriparatide for 2 years. Newer agents that have been discontinued, that's the selective estrogen receptor modulator, possess estrogen agonist or antagonist properties, showed promising results of the bone mineral density, accrual, and anti-fracture efficacy. To conclude, this systematic review has stopped. To conclude, in this systematic review, the authors have discussed newer therapies for osteoporosis that enhance the bone mineral density at all skeletal sites and reduce the fracture risks. Real-world data over time will provide more evidence for the efficacy of these novel therapies in the term of comparative effectiveness and anti-fracture efficacy in men, and to explore the optimal strategy for sequential or combined therapy in severe osteoporosis. We encourage all our readers to go through this review article and analyze it in detail. The next review article is a multi-specialty consensus on the individualized treatment strategies for hypertension phenotypes and comorbidities by Gurpreet S. Wander et al. Hypertension prevalence was demonstrated in 28.1%, of which only 8.5% were controlled. This highlights the need for personalized, evidence-based strategies. This multi-specialty consensus included 532 experts amongst 18 Indian cities. The BP monitoring recommendations included the ambulatory BP monitoring as a gold standard, and the alternative to that was the home blood pressure monitoring in case the ABPM is not available. An important takeaway for all hypertensive patients are lifestyle measures. Salt restriction less than 5 grams a day, the DASH diet, physical activity of more than 150 minutes per week, weight control with a BMI less than 23, limit alcohol and stop smoking, and good sleep hygiene and stress reduction. These lifestyle measures must be carried out for all patients. The important takeaways from this study were: number one, individualized care for better BP control. Number two, ambulatory BP or home BP monitoring for essential and accurate diagnosis. Number three, consider phenotype and comorbidities when planning therapy. Number four, use combination therapies and organ protective agents. Number five, lifestyle change is the core of every therapy starting. And number six, the Indian consensus provides a realistic and a practical guidance for our country. The next review article is on introducing a novel once a week DPP-4 inhibitor, Trelagliptin, in India by Bhupesh Dewan et al. This article emphasizes the role of a once weekly DPP-4 inhibitor, that is Trelagliptin, in India. DPP-4 inhibitors are established antidiabetic drugs. However, once or twice daily dosing often limits the long-term compliance. Trelagliptin is a novel once-a-week DPP-4 inhibitor which addresses this issue with an extended half-life and a superior molecular stability, enabling a sustained DPP-4 inhibition and a significant GV reduction. Now, improved glycemic control with Trelagliptin can potentially lower the risk of the macrovascular and microvascular complications associated with type 2 diabetes. Trelagliptin offers prolonged efficacy and high selectivity in inhibiting the DPP-4 enzyme, helping minimize the side effects. In a randomized phase 3 clinical trial involving patients with HbA1c more than 8, Trelagliptin showed a greater HbA1c reduction of around 1.25% compared to Vildagliptin, which showed a reduction of 1.15%, and a similar safety profile. Mild adverse events occurred in 6.67% of the Trelagliptin users compared to 9.17% in the Vildagliptin users. This article outlines the development and the regulatory journey leading to Trelagliptin's first approval in India by the Central Drug Standard Control Organization, that's the CDSCO, in December 2024. The phase 4 real-world evidence studies are currently ongoing in India to assess the long-term safety and efficacy. The next article is an update article on unlocking the future of Alzheimer's disease, innovations in diagnosis and therapy by Manmohan Mehendirata et al. Alzheimer's disease, as we all know, is one of the most common and devastating forms of dementia, making around 2/3 of all dementia cases globally. Despite its high prevalence, it remains to be underdiagnosed in 41 million patients with dementia, and with only about 25% of dementia individuals being clinically identified. Alzheimer's disease is a major neurodegenerative disorder leading to dementia characterized by neuronal atrophy and loss. The accumulation of toxic amyloid beta oligomers, protein aggregates, along with the formation of neurofibrillary tangles within neurons, is a key pathological feature of Alzheimer's disease. These abnormalities contribute to a decline in the cerebral glucose metabolism in the brain, synaptic dysfunction, and mitochondrial impairment. The progression of Alzheimer's disease is in 3 stages: the pre-symptomatic stage, the second, mild cognitive impairment, and the third, clinical stage of Alzheimer's disease. This article emphasizes the significance of the 3 main biomarkers categories for Alzheimer's disease. The first, protein markers, amyloid beta, tau, and NFL. The second, miRNAs. And the third, non-invasive sources such as blood and saliva. Imaging techniques, particularly PET and MRI, play a pivotal role throughout the disease course of Alzheimer's disease. from detecting early biomarkers in preclinical Alzheimer's disease to assessing structural and functional brain changes. While no cure currently exists, recent advances in the treatment strategies offer hope by targeting the disease pathology and improving memory as well as other cognitive domains. Ongoing research into disease modifying therapies and supportive care strategies offers hope for more effective interventions in the near future. Thank you for listening to JAPI podcasts.